Nephrotic syndrome is a kidney disorder where you leak out excessive amounts of protein through your urine, and it can lead to all kinds of complications. It can lead to swollen feet, ankles, legs, swollen hands, a swollen belly. It can cause swelling around the eyes. It can lead to high blood pressure, high cholesterol, blood clots, and yes, it can even cause kidney failure. Nephrotic syndrome can be bad news for both adults and children, so it's very important that you understand exactly what it is. And today we're talking nephrotic syndrome. Nephrotic syndrome is a rare kidney disorder, but when it hits hard. It can lead to multiple complications, including kidney failure, and it can affect both adults and children. So it's really important that you understand what it is. So this is what it is. If you think about your kidneys, you have these two bean-shaped organs located in your lower back and the flanks where the love handles are. Each kidney has 1 million glomeruli, or 1 million nephrons. And what these are the filtering system of the kidney. So each glomerulus, each of the filtering units, is responsible for essentially cleaning out the blood. You have these tiny capillaries which allow blood to flow through them, and it filters out excess water and tiny particles and waste. But in a normal kidney, these glomeruli, these kidney functioning units, will hold on to bigger particles like red blood cells, white blood cells, and protein. Well, in nephrotic syndrome, there is a problem with the way that these nephrons filter. Instead of holding on to protein in the blood, they filter out protein and allow the protein to get into the urine. And this is what leads to the problems. When you have excess protein in the urine, it leads to multiple complications, including edema, high blood pressure, high cholesterol, and even kidney failure. And I'll break it down and explain exactly how. So let's start with edema, which is swelling. It's a swelling that can occur in the feet, the ankles, the legs, the hands. It can occur in the whole body. You can get periorbital edema or swelling around the eyes. And this is how it happens. So your albumin, which is that protein that's leaking out excessively in the kidneys with nephrotic syndrome, well, that protein acts like a sponge when it's inside of your vessels. And it helps to keep fluid inside of the blood vessels where it belongs. Well, when you urinate out excess protein, like you do in nephrotic syndrome, you lose that sponge. And so you also lose the ability to keep fluid within the blood vessels. So what happens? That fluid leaks out into the tissues. And that's when you get that swelling, okay? The swelling all over the body. It's because the protein is low. Beyond the swelling just being uncomfortable, it can also lead to issues like ascites or excess fluid in the belly. It can lead to excess fluid in the lungs and cause shortness of breath as well. Edema is not the only complication from losing this excess protein in the urine with nephrotic syndrome. You can also get high cholesterol. Oh, high cholesterol, what sense does that make? Well, I'll tell you. Your liver is responsible for making the albumin, okay? It makes that protein. So when the liver senses that you've lost too much protein, well, you get low levels of protein in the blood, right? And what does the liver do in response? Well, it decides it's going to pump out more protein, right? Pump out more albumin. Well, in pumping out that protein, it also pumps out certain proteins that are associated with cholesterol, like LDL. And when it pumps out those proteins, it can lead to excess cholesterol. So as part of the responsiveness of the liver in trying to produce more albumin, it actually produces more cholesterol. And so nephrotic syndrome can lead to high cholesterol or dyslipidemia, which of course can lead to other complications like heart disease, strokes, and things of that nature. Be sure to watch my video on how to lower cholesterol naturally after you finish watching this video. Another complication of nephrotic syndrome is hypertension. Now, how is that related? I'll tell you. So I mentioned that albumin, that protein, is like a sponge that's supposed to keep fluid inside the vessels, right? So with the nephrotic syndrome, you've urinated out excess protein, and now you no longer have that sponge, and your blood vessels don't have as much fluid. So what happens is when the kidneys are censoring the fluid that's flowing through their vessels, flowing through those capillaries, flowing through those glomeruli, right, those filtering units, well, you have a decreased amount of blood volume, right? You have decreased fluid in the vessels. And so in response to that, the renin-angiotensin system is activated. What that means is that the kidneys feel like if you don't have enough fluid, then the pressure is too low. And so they try to make the pressure higher. And so they activate certain mechanisms that cause you to hold on to salt, cause your blood vessels to tighten, and it can lead to high blood pressure. So with this nephrotic syndrome, one of the responses is that you get an elevated blood pressure or hypertension. Another complication of nephrotic syndrome is blood clots. Yes, it's another complication that is related directly to losing too much protein through the urine. I'll explain. One of the proteins that you lose with nephrotic syndrome, one of the proteins that leaks out in the urine, is something called antithrombin 3. Now, typically, antithrombin 3 is a protein that will help to maintain proper clotting in your body, okay? It'll help to keep you from being hypercoagulable, meaning it'll keep your blood from clotting too much. Well, in nephrotic syndrome, you're losing all of these proteins through the urine, including antithrombin 3, and so you lose your ability to keep the blood from clotting too much. So what happens? You can get blood clots. You can get deep venous thrombi, okay? Or you can even get renal vein thrombosis. So basically, nephrotic syndrome can lead to a hypercoagulable state, leading to blood clots. And we know that some of these blood clots can even go to the lungs, causing pulmonary emboli. It's a problem. Be sure to watch my video on blood clots and DVTs after you finish watching this video. Another complication of nephrotic syndrome is kidney failure. With this disruption in glomeruli, the filtering units of the kidney, it can ultimately lead to the kidneys not filtering anything properly, leading to end-stage renal disease requiring dialysis or a kidney transplant. Nephrotic syndrome is pretty rare, but it can affect both adults and children. According to the NIH, the incidence of nephrotic syndrome in children is 1 to 2 cases per 100,000 children 16 years of age and younger. And in adults, it's 3 cases per 100,000 adults. Now, I've explained that nephrotic syndrome is when you have excessive amounts of protein in the urine. And some of you listening may be thinking, I've gone to my doctor, I've had my urine dipstick, and they told me that I had some protein. Maybe I have nephrotic syndrome. Well, there's a very specific way that we quantify how much protein is too much protein and how much protein we consider to be nephrotic syndrome. Nephrotic syndrome is when you urinate out 3.5 grams of protein or more in your urine in 24 hours. That's 3,500 milligrams of protein that you're excreting each day. That's a lot of protein. It's normal to have essentially no protein in your urine, or certainly less than 300 milligrams. Question: have you or someone you know been affected by nephrotic syndrome? Please share your experience down below. I would love to hear about it.